We are going to describe pharmacology of anticholinesterase agent. Acetylcholinesterase is found near the ending of cholinergic axon and also in erythrocyte. Acetylcholinesterase exhibit a relatively high substrate specificity. It primarily hydrolyzes acetylcholine. There is another type of cholinesterase called pseudocholinesterase or butyryl cholinesterase. It has a different distribution and substrate specificity. Pseudocholinesterase is found in the bloodstream, in the liver, and in certain effector cells. The substrate specificity of the pseudocholinesterase is low. It not only hydrolyzes acetylcholine but will also hydrolyze esters and related to choline. For example, ester type of local anesthetic like procaine. And of course, as you know, succinylcholine is also hydrolyzed by the enzyme pseudocholinesterase. Normally, an injection of succinylcholine has a duration of action of about 10 to 15 minutes. However, in some individuals, it may take longer. This is due to genetic variation. Roughly in every 3,000 individuals, one is found that carries a typical form of pseudocholinesterase. The atypical enzyme hydrolyzes succinylcholine very slowly. If a patient with atypical enzyme receives succinylcholine, it will remain paralyzed for several hours. This is called idiosyncratic reaction. There is a test called dibiocaine test, which can be used to identify susceptible patients. In this test, percentage of inhibition of serum acetylcholine activity produced by a standard concentration of dibiocaine is determined. The atypical enzyme is relatively resistant to inhibition by dibiocaine. Anticholinesterase drugs are two types, reversible and irreversible. Example of competitive or reversible anticholinesterase drugs are physiostigmine, also called eserine. It is originated from calabar bean. Other drugs like neostigmine, pyridostigmine, rivastigmine, hydrophonium, and carbaryl. These are examples of competitive anticholinesterase agent. The inhibition of acetylcholinesterase produced by these agents can be overcome by increasing acetylcholine concentration, and also enzyme can be reactivated by dialysis. Edrophonium is unique among them because it only combines with the esteric site of the enzyme and hydrolyzes quickly. That's why it has a brief duration of action. Acetylcholinesterase and pseudocholinesterase are equally sensitive to the action of competitive inhibitors. Examples of non-competitive inhibitors are ecotiophate and malaxon malation. Other examples are toxic organophosphorus esters. For instance, nerve agent like soman, sarin, tabon, and diflose. These are nerve agents that are organophosphorus esters. Organophosphorus esters are non-competitive or irreversible inhibitor of acetylcholinesterase. They firmly bind to steric site of acetylcholinesterase. However, ecotiophate also attached to the ionic site. Anticholinesterase poisoning may occur from exposure to insecticides or nerve agent. Inhibition of acetylcholinesterase delay biotransformation of acetylcholine, resulting in excessive sweating, salivation, and bronchial secretion. Meiosis, bradycardia, and diarrhea. When acetylcholinesterase is inhibited by about 80%, depolarizing block can be occurred at the neuromuscular junction, as we have explained for succinylcholine. This is due to respiratory paralysis. Carbaryl and malation are used for treatment of lice infestation. Malation is a prodrug which is converted to malaxon. In fact, the inhibitor of the acetylcholinesterase enzyme is malaxon, not malation. This conversion is occur more rapidly in the insect, including the lice. Absorption of the drug from the skin is negligible, so there is a distributional selectivity. You directly apply the drug to the environment on which the parasite is living. However, if it is absorbed, it will be toxic. Myasthenia gravis is a disease in which cholinergic transmission at the skeletal muscle is impaired and characterized by weakness of skeletal muscle. The cause of transmission failure is an autoimmune disease that causes a loss of nicotinic receptor at neuromuscular junction. Anticholinesterases drug can be used for diagnosis and treatment of myasthenia gravis. Although muscle weakness is in all over the body, however, the muscle weakness is more obvious in facial muscle. The eyelids are largely controlled by skeletal muscle. As you can see in this picture, this patient hardly can retract his eyelids. Neostigmine or physiostigmine is used to treat myasthenia gravis. Notice that it is a symptomatic treatment. It does not cure the disease. Drug treatment only alleviates the muscle weakness. These drugs enhance acetylcholine at cholinergic synapses. In order to minimize the effect of acetylcholine at the muscarinic receptor, it is given in conjunction with atropine. Overdosage with neostigmine or physiostigmine can itself precipitate muscle weakness due to depolarizing block of neuromuscular transmission, which is called a cholinergic crisis. Edrophonium can be used to distinguish between a cholinergic crisis and the effect of undertreated or increased disease severity. An IV injection of edrophonium will briefly increase muscle weakness, but will briefly increase muscle power in the cases of underdosage with anticholinesterase drug. Neostigmine is also used to reverse the action of non-depolarizing neuromuscular blocking drug, such as tuboclarine or pancronium, usually used at the end of operation. The injection of neostigmine is preceded with an injection of atropine in order to minimize the effect of acetylcholine at muscarinic receptors. Physiostigmine and ecotiophate are useful as a myotic drug. Physiostigmine is also useful for counteracting the action of mydriatic drugs. Both of these drugs are useful for lowering intraocular pressure in congestive glaucoma. The use of this agent in the eye carries a risk of systemic toxicity, since they are both well absorbed from the conjunctival sac. Remember that, like pilocarpine, these drugs also affect eye accommodation. Anticholinesterase drugs such as rivastigmine, tocrin, and domperidone that readily crosses the blood-brain barrier are used for treatment of Alzheimer's disease. More detail will be given when you have a pharmacology of central nervous system. As I mentioned, organophosphorus esters are toxic agent, and you should know how to treat toxicity with this agent. Anticholinesterase poisoning may occur from exposure to insecticides in the factory that producing them in the industrial section, or in the agricultural farm where they have been used. As you know, they also have been used as a chemical warfare in the military. Remember, the inhibition is irreversible. If the phosphorylation is recent, the enzyme can be reactivated by agents that are more nucleophilic than water. For example, peroxidoxin or obidoxin. Industrial, agricultural, or military poisoning with nerve agent is treated by injection of both peroxidoxin and atropine. Atropine reduces exocrine gland secretion such as sweating, salivation, bronchial secretion, also block the effect of acetylcholine on the heart and smooth muscle. This figure shows hydrolysis of acetylcholine by the enzyme acetylcholinesterase. The enzyme has two active sites, an ionic site and esteric site. Acetylcholine molecule attached to both ionic and esteric sites, and positively charged nitrogen is attracted to the ionic site. Other end of the acetylcholine molecule is attracted to the esteric site, and hydrolysis is catalyzed at the esteric site to form choline and acetic acid. Nerve agents which are partially electropositive, they have a electropositive phosphor, is attracted to the partially electronegative serine at the steric site. Side chain of nerve gas is attracted towards ionic site, resulting in bond break at this position, and after that a stronger bond is formed with the steric site. Cholinesterase inhibitor attached to the steric site prevent the attachment of acetylcholine. Cholinesterase enzyme is blocked but can be regenerated by an auxin at this stage. However, if another group is removed, then aging takes place. It is possible that a couple of side chains to be removed. If another group is removed, this bond becomes more strong and cannot be hydrolyzed anymore. It is said that aging has taken place. If aging takes place, the enzyme cannot be reactivated. When couple of side chains are removed, the age bond is formed which cannot be hydrolyzed by water. Before aging, if pyrrolidoxine is given, it can reactivate the steric site. Partially electropositive nitrogen on pyrrolidoxine is attracted to electronegative ionic site. Pyrrolidoxine then reacts with the organophosphorus agent. Now, this complex is easily removed from the enzyme site and acetylcholinesterase is regenerated. However, this cannot occur after aging has taken place. Therefore, pyrrolidoxine must be given as soon as possible. For this reason, self-injection pen is provided for the soldiers or for people that may expose to this agent. Pyrrolidoxine usually is in combination with atropine in order to reduce excessive muscarinic response. Notice that atropine dose is relatively high and only should be used if there is organophosphorus poisoning. Otherwise, it will cause atropine poisoning, which is the subject of next lecture. In this slide, we have compared a reversible anticholinergic drug like neostigmine with a nerve agent, diflux. Neostigmine is a reversible anticholinergic drug. It attaches to both steric and ionic site and then hydrolyzes by the enzyme. But hydrolysis takes many minutes. Enzyme acetylcholinesterase is very efficient in hydrolyzing acetylcholine. It hydrolyzes 1,000 molecules of acetylcholine in a millisecond. However, the hydrolysis of neostigmine takes time, and that's why it delays hydrolysis of acetylcholine. On the other hand, nerve agent only attached to steric site, and as I explained, it forms a strong bond which cannot be hydrolyzed easily. Palidoxine can interact with the phosphor group in here and remove the nerve agent before aging takes place.